Hey, so thank you, Stacey, for that introduction. So my name's Taylor. I've been working at Moby Healthcare for about 18 months, coming up on 2 years shortly. And I'm very, very lucky to work where I work. They're all fabulous people, and I get to deal with a lot of people with Parkinson's, and it's one of my favorite groups to take. I find them a lot of fun and very engaging and very active and getting ready to help with themselves. So I quite enjoy it. But we might jump straight into it. So I've got my PowerPoint. Again, try and hold your questions to the end, and I'll try and answer them to the best of my ability. But ready to go. So we're going to go through an introduction into the pelvic floor and what that means within the Parkinson's population. So we'll just go through a little bit of the anatomy of the pelvis and the pelvic floor there. So you've got your three pelvic bones that form a ring, and this ring creates a pelvic cavity where all of those organs sit in, and they are three major organs. So you've got your bladder, your uterus, and your rectum. Pretty straightforward. We can go through a little bit of the anatomy of the pelvic floor. So the pelvic floor is essentially a floor for the pelvic cavity, and this cavity is both made up of muscles and fascia, and these things work together to support those organs. So without your pelvic floor, unfortunately, that means that some of your organs would probably fall out. So the way that we like to think of the pelvic floor is like a hammock or a sling. Yep, so you have your hammock tied up to the ends of your poles, and if you lay on your hammock, that hammock is holding you up, and that's how we think of our pelvic floor. But remember, if it's under a really, really, really high load, it can become stretched and it can become lax. And sometimes it can rupture, which does happen, but it's not as often. But one of those places where that can happen is during pregnancy. So you've got the two different layers. So you've got your deep layers and your superficial layers. So your deep layers are really, really inside there, up tucked in, and then your superficial layers come and they perform more of that outside of the hammock, and they work to lift your pelvic floor up and squeeze it really, really tight. And that is then the activation of that pelvic floor. So how do the muscle and the fascia work together? So the muscles are the strength behind it, and the fascia is that hammock. So if you think of it like a trampoline, so if anyone's tried to jump on a trampoline, sometimes you feel like your insides are squishing down really, really far. That's okay, that happens. But what we want to do is so say that the ball on that trampoline, that big red ball, is your pelvic organs. We want to use that fascia, that hammock, to hold those organs in, and then we train those muscles to push it back up. So what happens if you leave the bowling ball on the trampoline? So if you leave that bowling ball on the trampoline, like in time, that trampoline starts to sag and it starts to stretch and it starts to become a little bit ineffective. All right. And then if you then try and bounce that ball, it just puts all of this pressure down the bottom, and that's when it stretches even further. But then we want to try and use those muscles to train it so we can hold that ball up as high as we can. So that's what your pelvic floor does. So we're holding and squeezing and lifting so that that trampoline has time to regain its strength and to gain its flexibility so that we can hold all those organs in. So your pelvic floor and your core. So your core are those big muscles in your tummy. So you're looking at these muscles through here that create kind of a cylinder. So what this cylinder does, we want to stabilize our core. So you've got your diaphragm, which is where we do all of our breathing. We've got our pelvic floor underneath, and then we've got our abdominals in the middle. So when we're training our pelvic floor, we're training those muscles in the abdominals, that wall. So we call it our corset. So it wraps around from your belly button all the way around to your back, a bit like a corset. we want to train those. So you can think of it like a can. If we squish a can, we're squishing those sides in nice and strong, and it creates a little bit more strength through the can. So that's what we're working on. We're working on squeezing through and working on those walls so that we create a stronger top and bottom. So yeah, we've got pressure going down, we've got pressure going in, and we've got pressure going up. So we're really, really working on making that nice and strong so that, again, we can keep that hammock or that trampoline nice and connected so that we can hold all those important organs in and train those muscles to lift them up nice and high. So a few issues that can arise from the pelvic floor. So these issues include not enough muscle activation, or it includes issues with that fascia, or it can be both. So what we like to do within our programs or in Parkinson's in general, we like to train both of them. So we like to work on the muscle activation, we like to work on this fascia activation, and we like to do that all together. So I will go through some exercises and some examples a little bit later on in our presentation, but that's what we're trying to do. We're trying to work them both together so we can build them and make it stronger for the future. So that's what a healthy pelvic floor relies on. It relies on both of these things, and it's predominantly used to support those organs. So some dysfunctions, there are three main categories. So you can look at urinary disorders, and this includes urinary incontinence. So that can be such as void incontinence, or you can do bladder holding or anything like that. So that's when you might feel like you really, really need to go to the bathroom. You try and go and relieve your bowels, but you might not feel like you're emptying enough. You might feel like you've still got more left in there. It can also be feeling like you've emptied too much as well, or it just feels like you can't go or you need to go all the time, which is quite common. And these are some things that we can target with our exercises as well. So that's our urinary stuff, so our bladder control. There's also ones with prolapse disorders. So this isn't spoken about as much, but something that we are still figuring out as well. But that's where the anterior wall inside collapses and it starts to bulge out of the body. Same thing, we can use targeted approaches to work on that as well. But that one is more dealt with as a women's or a men's health physio. They tend to target that a little bit further. If that is an issue, we can touch on it. But if that is something that you were looking at, if that's something that does affect you, I do recommend seeing a women's or a men's health physio for that as well. That can be through the anterior wall or the posterior wall, which can either be through the rectum or through the vagina. So that's just something that we can work around as well. It also, your pelvic floor also works around bowel disorders as well. So if you are having a bit of fecal incontinence or constipation or obstruction, that's something that you can target through exercise as well. So why does a weak or lax pelvic floor cause leakage? So you think of a tap. Sometimes you try and twist the tap as much as you can and it still has that little leak. That little leak can be issues with that pelvic floor. So not being able to secure your hammock and use your muscles to lift it up to help that bladder control. So that's what we want to do. We want to try and tighten that tap as much as we can and create a nice firm backstop to then take away that leakage. So there are a few neurogenic pelvic floor dysfunctions. So this one is based off constipation and fecal incontinence. These are really, really common in anything from spinal cord injury to MS to Parkinson's and stroke, but the mechanism is generally a little bit different in Parkinson's from those other conditions. So 30% of people reported that they have daily and unsuccessful attempts at defecation or emptying their bowels, and this is quite normal. So because of the increased amount of medications that you have to take, that can cause a few obstructions in your bowels. So we like to try and educate and use exercise to try and help that process work along a little bit smoother. And there is a higher prevalence of mild colorectal and pelvic floor symptoms, and they have a 7% severe constipation. So that means that it's a hard one to word. It's those pelvic floor symptoms are sometimes hard to reverse, but we can always do our best to improve them. So someone who has a really, really strong pelvic floor, that's fantastic, but sometimes there are things to do with with Parkinson's that stop that from regaining its full strength. So we can work on it to get it back on track, but there's no real telling if it's going to get back to exactly where you wanted it to be, because there's other things in play as well, some neurological factors as well as aging and things like that prevent you from going back to where it is, exactly it is where you want it to be. So but there is still a fair bit of research and things like that coming around. So we're just trying to navigate those waters as much as we can. Don't really need to go through the rest of that. Let's move to the next one. So there are a few things that you can do to try and help it. So there are dietary things that you can, I think there is a couple in the next couple slides, there are a couple foods and things that I've listed down for you guys that can disrupt your pelvic floor. It sounds a little bit funny, but there are a few foods that also can do that. If needed, you can use laxative or constipation medication. That's not a bad thing. Again, consult your GP about that before you do something like that, though. There is a certain medication that can reduce the symptoms in constipated patients with Parkinson's, but again, consult your physician or your GP around that as well. You want to increase your daily intake of insoluble fibers. That reduces your constipation-related symptoms and it improves that absorption of that medication. Again, there will be some foods in the next slide for you guys. Lifestyle modifications. You can try scheduled emptying. Works for some people, doesn't work for some people. That's one that you might have to play around with. Make sure you have really, really good bowel habits, trying to go to the bathroom at least 1 or 2 times a day, and increasing your physical activity. That's what it all generally comes back down to, is the more physical activity we can do, the better it is for our system. Urinary incontinence, this is a big one, and it's very, very prevalent in females, and it is also very prevalent in males. I don't think it's spoken enough about in the male population. There is a little bit of a stigma around it, but we're seeing a lot more of the male population coming to us that have had bladder and bowel issues, and it's really refreshing to see that there are more men that are interested in helping their pelvic health. So thank you again to all the women and the men who have clocked in today to see us. So it does say that there is an estimated that 2 out of 3 Parkinson's patients do have some degree of bladder dysfunction. And these are generally around the retention of urine, the frequency of urinating, and urge incontinence. So urge incontinence is feeling like you always need to go to the bathroom. These things are relatively normal in Parkinson's patients, which is not necessarily going to go away completely, but we can help it to improve it. So unfortunately, there's not enough research out yet. There is more research being conducted now, but it's just one of those things that we have to try and move along with as the research moves along. But it's something that we are trying to improve on in this population. So rigidity or tightness in your muscles can incomplete or slow the relaxation of these muscles when voiding or decrease the ability to empty your bladder. So the way that your muscles work can be an issue in this topic. So that's the part of the side, that's the side that we like to target. We like to target the muscle side. There are a few other things that you can do, but that's predominantly what we work through. And that can be working around your hesitancy in initiating a void, so initiating a stop, slowing the stream of urine or incomplete emptying. So they're the three things that we like to target. So we try and find the root cause of why you're voiding, how you slow the stream, and why you're incomplete emptying. But we will go through that a little bit through our exercises as well. Your bladder can become overactive. So the only real way to see this is by performing a bladder ultrasound. You can have a look at what your bladder is doing. And basically this just means the tendency for your bladder to spasm more frequently and inappropriately. So it's just your bladder not reading your brain. There's a connection between your brain and your bladder that's just disrupted a little bit. And that's where those issues can lie through as well. So it's about treating that neurological side of it as well as the muscular side of it to try and help with those processes. So as you guys probably know, if you drink lots of water, you feel like, or lots of fluid, you feel like you need to go to the bathroom a lot more frequently. Too little water increases the acidity in your urine and it can irritate your bladder. So you want to try and find that balance. Everyone's water intake is a little bit different. I like to say with most of my Parkinson's patients, because they are on a lot of medications, consult with your physician or your GP as to how much water you should be intaking. Sometimes they say 1.5 liters, sometimes they say more 2.5 liters. It just depends on what your other contraindications are. If you have any other symptoms or other issues or things like that, that can be that can move around. So make sure you try and consult your physician about how much water you should be drinking. You want to schedule your voiding, so make sure you try and go to the bathroom at least 4 or 5 times a day. To make sure you're trying to empty. If you need to sit there for a little bit longer, that's okay. You can also, there's a few other strategies that we can use. Sometimes you use a TENS machine, which uses electrical impulse to try and work on that pelvic floor. You can either there are devices that you can get that are internal, or you can get some devices that are external as well. I do have a patient of mine who does use an internal probe, and it's like linked to your phone and she can play games on it. It's quite fun. So some of the stuff below, so you can see on the right-hand side, I have put some food on there that does provoke that urinary incontinence. So again, you want to modify your fluid intake. So again, consult your physician or your GP around how much fluid you should be intaking. Alcohol brings on incontinence. Carbonated drinks, so anything fizzy, like mineral water or soda water, caffeine and coffee, milk, tea, tomatoes or tomato-based products, highly spiced foods, sugar, citrus, honey, chocolate, corn syrup, and artificial sweeteners. So that honey and chocolate, sugar, the good stuff. But yes, unfortunately, that does bring on urinary incontinence. Again, you just want to try and modify those. So it doesn't necessarily mean cut them out completely, but just limit the intake to try and help with that as well. So how do you know you're using your pelvic floor? It's a fantastic question, but it is a very, very tricky question to answer. There are a few ways that I like to discuss with my patients how to engage their pelvic floor. So can everybody sit on is everyone on a chair? Yep. All right. I want everyone to sit on their chair. I want you to put your hands on your hips. And then what I want you to do is I want you to squeeze your bottom together and try and draw everything back up into your belly. So you want to draw it up and then you want to release it out. Another one that we can do is you want to feel like you're holding wind. So as you're sitting there, so it's trying to block wind from exiting, and then you release. Another one that we can use is you want to try and draw your urine back up into your body. So as you're sitting there, feel like you're trying to draw your urine back into your belly, your bladder, and then you release. Try that one again, drawing urine back up into your belly and release. If you're doing it correctly, you should feel something really deep inside, feeling like it's tightening, and then as you release, feeling like it's loosening. So you want to keep your belly nice and relaxed, but you want to try and feel that draw in. There are a few different cue words that we use. So we like to use the stopping wind. We also like to use the draw your urine back up. If that doesn't work, a good one for males, I know it sounds a little bit risque, but nuts to guts. We like to use that one as well. So it's just finding the right cue words for you to try and activate that pelvic floor. It's a difficult one to activate, but once you know how to do it and you get that feel for it, you will be able to do it. So I've got some examples of exercises below. So a lot of these exercises are performed on your back. So you can do this if you're comfortable getting on the floor, you can get on the floor. If you're more comfortable doing them on your bed, you're more than welcome to do them on your bed. They're quite simple. They don't use a lot of equipment. As you can see there in a couple of the photos, there is the use of a ball, which just helps with that squeeze. So what we do with the ball is it provides that contraction through the insides of your legs and it draws up into those deep muscles of your pelvic floor to try and help with that stabilization. So when we're doing these exercises, particularly the ones laying on your back, the main thing that you want to focus on is drawing that urine up and making sure there's a nice flat line under your back. So what you want to avoid is you want to avoid tilting your hips because you don't want to be able to fit a hand under your back. So sometimes these are the first steps that we do. We push and draw our belly button down into the ground so that we have no gap under our back here. And so we can activate. So activating your pelvic floor through these exercises is the most important part. The exercises by themselves will definitely help to strengthen your core, but if you really want to target that pelvic floor to help with that bladder control, you will have to really work on engaging that pelvic floor. If you want, like the best thing that you can start with is trying to hold that pelvic floor for about 10 or 15 seconds while maintaining steady breaths. One of the harder things to do, but it's one of the first steps that we work through. So if you can work through that, then you can definitely put it through into these exercises. With the exercises, you roughly want to perform around 10 to 15 repetitions, and you want to do about 3 sets. So you do 15 or 10 to 15, have about a 2 or 3 minute break, go again, have another 2 or 3 minute break, and then try again. So that's your 3 sets. I'd pick maybe 2 or 3 exercises to do every day, and then you'll be able to feel your pelvic floor strengthening that little bit more. So we have these exercises down here. You've got your alternating arm drop. So that's where you're just laying on your back, your arms are nice and strong up to the air, and you drop one at a time. Yep. The next one to the right is a similar sort of thing, but you've got the ball between the knees. You don't have to do it with the ball. You can, if you like, you can substitute it for something like a pillow. And that's where you want to drop both of your arms at the same time. The one down the bottom left-hand side is called a glute bridge. So that's in that similar position to that first one, that you're going to push through your heels and lift your bottom up off the floor, and then try and lower it down. It's okay if you can't get to that full height, but we always want to try and aim for as high and as strong as we can, making sure you're squeezing up through the bottom and keeping that pelvic floor nice and strong. The one down the bottom in the middle is your straight leg raise. So that's where you're laying on your back. You're going to lift one leg up at a time and drop it down. If that's too difficult for you, you can always bend that straight leg that's down on the bed into one of those positions in those top exercises. That's another way to make it a little bit easier. And then I'm sure you guys do lots of sitting and standing from your seat. So same thing, you want to put that ball or that pillow between your knees, turn that pelvic floor like what we did in our sitting, and do some sitting and standing. Some other ones, these are a little bit more advanced, so see how you go with these ones. This one up here is a very tricky one. It's an ab burner. Even my abs get sore doing this one. So this one is where you pick both of your legs up off the floor and then tap them back down to that starting position. You lift them up and tap them back down while they're bent. The one underneath is similar to the one on the previous page. It's just got that ball between your knees to add that little bit more. This one up the top right-hand side is again similar to the one before where we did our alternating arms, but you're also going to drop one leg. And then for those of you who are okay to go on hands and knees, it might be a little bit of a stretch, but you can see how you feel. You might just want to put some cushioning under your knees and your wrists to try and alleviate some of that pressure. You squeeze that ball between your knees, keeping your back nice and straight and trying to reach one arm at a time over your head. So these exercises are best performed nice and slow and controlled. We like to say quality over quantity. So I'd rather see them done really well and not as many, rather than just trying to do as many as you can as fast as you can. We don't want to see that, otherwise you're not doing it properly. We want to make sure that our pelvic floor is really activated so that when we're performing these tasks, they're done to the best of our ability.